this case, this man, 45-year-old man, had a history of paroxysmal atrial fibrillation several years ago, but wasn't treated because the symptoms were very intermittent. But now he has increasing episodes of palpitations. He's otherwise fit and well, has no other cardiac risk factors or other cardiac history. And ECG usually in these patients is usually sinus by the time you see them. Blood tests in this case were completely normal, including thyroid function. And again, how would you manage this sort of patient? A younger patient but symptomatic with a history of paroxysmal atrial fibrillation. So let me just recap. Atrial fibrillation, as I'm sure you all know, is due to chaotic, disorganized activity in the atria. And usually the pathology occurs in the left atrium and causes these multiple micro reentrant circuits in the atrium that cause this surface ECG to look very irregular. And the main problem with atrial fibrillation is that when it's irregular, clot can form in the left atrium, and that can lead to a stroke if it breaks up and goes to the brain. And atrial fibrillation, we know, is much more common in older people. 6% of the people over the age of 65 are estimated to have atrial fibrillation, 10% over the age of 80. In Singapore, it affects about 1 to 2% of the population. And the worrying thing about atrial fibrillation is that many patients, particularly older patients, don't feel any symptoms. So they may have AF and not realize it, but yet be at very high risk of having a stroke. So I think as clinicians, it's important that we try to take the opportunities when we see patients to try to pick up atrial fibrillation, especially in the older patients who have other cardiac risk factors. So this quite old slide now shows as patients get older, the risk of AF increases, and men, AF is higher than women and all age groups. What are the risk factors causing AF? Multiple risk factors that I'm sure you all know. Of course, hypertension, diabetes are important risk factors, as are thyroid disorders, but also age and male gender, as I mentioned. But other things like sleep apnea, often people don't realize sleep apnea is an important risk factor for AF. And in fact, if we identify that, we should treat sleep apnea whilst we treat AF.